good morning. My name is Max Sue, and the name of my presentation is There's Something Fishy About These Eyes, a case that certainly is more than meets the eye. So let's get started. All right, chief complaint. We have a chief complaint of film over my vision. So this is a 42-year-old female who presents with gradually worsening blurry vision, foreign body sensation, and pressure sensation in her eyes over the past month. Now, interestingly, she did tell me that she recently moved from Mississippi to Central Texas, and her hometown in Mississippi is a lot more humid. She's saying that whenever she moved to Central Texas, she felt like it was more dry, it was windy, and this summer, maybe some of her allergies have been acting up. As you can see, no significant past ocular history. Past medical, surgical, and social history are pretty unremarkable, but she does tell me that she has a brother that's had similar symptoms before in the past. All right, so moving on to our exam. As you can see here, her best corrected visual acuity with her current glasses is 20/30 OU, but her pupils, pressure, visual fields, and motility were pretty normal. So we move on to our anterior segment exam here, and we notice evidence of meibomian gland dysfunction, OU. But the rest of her anterior segment exam is pretty unremarkable. So all right, let's put this all together. We have a relatively young female who's moved from a more humid environment to a drier climate. She has shown evidence of meibomian gland dysfunction on our exam. Ladies and gentlemen, I think we have our diagnosis. So this morning, I present to you a riveting case of dry eye syndrome. Now, a lot of my colleagues, they'll grumble and they'll balk whenever they get a case of dry eye syndrome in their clinic, but I take it very seriously. And as you can see, the academy would tend to agree with me. They put on the level of angina. So, case closed. I was patting myself on the back, well on my way to becoming resident of the year. And as I finished my anterior segment exam, I thought to myself, all right, what are my treatment options here? I want to do lid hygiene. But then I thought, Alcon did buy me a very delicious lunch about 3 months ago, so I decided to tell my patient all about Sustain, these lubricating eye drops that, as you can see, is the #1 doctor-recommended brand. But then I thought to myself, all right, Max, you got to be a good resident. Maybe we should just go ahead and look in the back of the eye. I mean, she's dilated, she's already here, so let's just go ahead and do that. So I put my dry eye syndrome talk in my back pocket, pull out my 90, and this is what I see. So just looking into these eyes, I think we can all agree that there is something fishy about these eyes. And since they're essentially symmetrical, we can go ahead and zoom in there on the right eye. I look into the back of the eye, the vitreous is normal, the cup to disc is 0.3, vessels are normal. But then I think to myself, boy, there is something fishy about these little flecks. So we get a little bit more testing here. We get an OCT, and as you can see in the OCT, we do have some RPE disruption over there in the right eye. And then when we get the left eye OCT, we see very similar findings here. We have some RPE disruption, these little lumpy bumpies there. So we go ahead and continue and get an autofluorescence. And if you remember on fundoscopy, we have these yellow to yellow-white fleck-like deposits in the RPE, these pisiform fleck-like lesions. And so they correlate here on FAF with these hyperfluorescent and hypofluorescent lesions here. And that hyperfluorescence is due to the lipofuscin accumulation, and then the hypo is due to the RPE atrophy due to the toxicity of the lipofuscin. And so this lady is just begging me for more tests, so I go ahead and put an IV in her, and we get an IVFA. And very interestingly, on IVFA, we see this dark choroid sign, and that's due to the lipofuscin in the RA, or in the RPE that prevents the choroidal fluorescence from coming through. All right, so putting this all together again, we have these interesting pisiform lesions in the fundus. We have disruption in the RPE and correlating findings on FAF. In addition to that, we have a dark choroid sign on IVFA. So we had to think of a list here, and although there is a massive list of things that can cause lesions in the fundus, this is the list I present to you this morning, largely because, well, this is as far as I've gotten in the BCSC books. So let's get started. Differential number 1, we have fundus albipunctatus. Now, this is an autosomal recessive disease, and if you remember, she did tell us that her brother had similar symptoms before. In fundus albipunctatus, we see diffuse small dots, mostly in the mid-peripheral fundus. And although this is absolutely abnormal, I wouldn't say it's necessarily fishy enough, so I think we should keep moving. Drusen and AMD should always be considered. Small yellow white spots deep to the retina, which are sometimes calcified, but we probably see this all the time in our clinics, and so I don't really think it's rare enough to be considered fishy, so we'll keep moving. Cone dystrophies are very interesting because, especially late in the game, we can see what's called a bullseye macula. Now, although this bullseye macula is very, very neat, I would say that it misses the target. So let's keep moving. Plaquenil maculopathy has to be considered as well, especially because it just presents so interestingly in the fundus there. So we also see this bullseye macula, and very neat, we see this flying saucer sign, especially late as the disease progresses in the OCT. When questioned further, she did say she had a close encounter of the third kind once, but she didn't want to elaborate, and I didn't want to push. She also said that she's never had any Plaquenil or any kind of autoimmune disease that she knows of, so I think that's off the table. All right, in MUDES, we have multiple creamy white lesions in the outer retina, or the RPE, and we also have correlating hyperfluorescent lesions on FA. This is looking a little bit more similar to what we see in our patient, but it's not quite there yet. And as I'm looking at this slide, I'm not sure why I have multiple pictures of evanescence in here, but anyways, let's keep moving on. We also need to be thinking of some infectious etiology as well, right? So she tells us that she's recently moved from Mississippi, so we got to think about ocular histoplasmosis. In ocular histoplasmosis, we see these yellow-white punched-out spots deep to the retina that are super interesting, but really don't correlate with what we're seeing in our patient. Additionally, she tells me that she gave up spelunking a long time ago after being attacked by a group of starling birds and hasn't been cave diving since, so probably not ocular histo. All right, so this brings us back to our case unknown. When we look into these fishy eyes, I just can't help but think of the massive trout that I always seem to catch whenever I cast a line. A familiar tune by Hank Williams called Stars in Her Eyes. How I just cannot wait to teach my little daughter, Nora, all about her ABCs. And of course, I cannot help but think of my favorite future fishing partner. So, as we look into these very, very fishy eyes, we want to put everything together. We got massive trout, we got Hank Williams, we got Barney and Friends, and we got the cutest little fisherwoman that you ever did see. We got to think Stargard. So next time you look into eyes like this, I hope you think to yourself, boy, there is something fishy about these eyes. I had to do a shout out to my wife here who just begged me to put this picture of her in here. She always seems to catch more fish than I do. This is my very first fishing buddy. This is Ellie the dog. And of course, we have my daughter here who knows exactly what you do with fish right after you catch them, as displayed by her onesie there. So for our patient, I sent her home with a crisp, clean bottle of Systane lubricating eye drops. Thank you very much.